Hello, I'm Charlie Whitaker. I lead human resources at Altria, but I'm coming to you today from my home in Richmond, Virginia, because we are still in this pandemic. So first and foremost, I hope you and your families and loved ones are doing well and staying safe as we start to emerge from the pandemic. I'm here today to introduce the new program for how Altria will deliver healthcare benefits to salaried retirees and eligible dependents age 65 and over. Is a Medicare eligible retiree or a Medicare eligible dependent of a retiree, with this new program, you will have more choice, control, and personalized assistance than you have today to find health plans that best meet your individual needs and budget. From Altria's standpoint, this new approach also enables us to offer high-quality health coverage options in a more financially sustainable way than exists today. Let me describe this in a little more detail. As you know, Altria currently offers a single, standalone group medical plan to Medicare-eligible retirees and their dependents. Because this plan is one size fits all, it works well for some participants and less well for others. In addition, the cost of medical coverage for Altria and our retirees continues to increase, and it may not be the right coverage for everyone. So like many other companies, we explored ways to offer the same or better benefits as our current program while mitigating cost increases. Through Via Benefits Insurance Services, we found that Altria can offer access to more choices, including medical, prescription drug, dental, and vision plans that you can customize for your own needs. You'll do this with one-on-one support from licensed benefits advisors who have lots of experience with just these kinds of transitions. These benefits advisors will help you navigate the options to find the right plan for you. Now, the COVID-19 pandemic has challenged us in many ways, and it's underscored the importance of healthcare coverage that provides safety, security, and protection. This new program delivers on those needs. So I urge you to take full advantage of the services provided by Via Benefits and enroll in your new plans by August 31 of this year, 2021. Doing so will avoid a gap in coverage and help you get the right coverage for your unique situation. So let me repeat that because it's important. Please take full advantage of the services by Via Benefits and be sure to enroll in your new plans by August 31 of this year. Now, I realize many of you don't like the idea of having to enroll in a new health plan or research these other options. Please know we wouldn't be doing this if we didn't think it made good sense for both our retirees and our company. And we're committed to making this transition as smooth as possible. So if you're a retiree, thank you for your many contributions to Altria over the years. Or if you're a dependent of one of our many fine retirees, please know how grateful we are for their contributions to Altria or one of its companies over the years. Thank you.
Hello. Welcome to this video presentation for Altria Medicare eligible retirees. My name is Bill Tisdale, and I'm an ambassador for Via Benefits, a part of Willis Towers Watson. As you view this presentation, I hope that you find what I share to be informative and helpful as you consider changes in your healthcare coverage. First on our agenda, I'll talk about who we at Via Benefits are and explain the transition from your current Altria healthcare plan to individual Medicare plans that you choose through Via Benefits. I'll explain the basics of Medicare, the types of plan options that you'll have, and how those options can work for you. I'll talk about the Via Benefits enrollment process and what you can expect when the time comes for you to enroll. I'll introduce you to your Health Reimbursement Account, or HRA, and how you can use that to help pay for your medical expenses. For our final topic, I'll go over the steps that you may need to take within the coming months. With that, let's get started. Hundreds of employers of all sizes, both public and private, including many of the largest companies in the world, have trusted Via Benefits to help their retirees when it comes to Medicare. VIA Benefits is the first and largest private company to offer this service. Over the last 15 years, VIA Benefits has helped over 2 million people transition to individual Medicare health insurance. And we've completed these transitions with continuously high customer satisfaction. We're not an insurance company, we're an insurance marketplace. We offer plans from over 120 national and regional insurance companies, which gives you a wide variety of choices so you can find a plan that meets your individual healthcare needs and budget. VIA Benefits is available to you online 24 hours a day, 7 days a week, or on the phone by calling 1-833-945-1104, Monday through Friday, from 8 o'clock in the morning until 9 o'clock in the evening, Eastern Time. We have an online help and support center with articles on how to use our tools and services, as well as information about Medicare. When you call our toll-free number, you'll reach one of our 3 service centers in Utah, Arizona, or Texas. All of our benefit advisors are based in the United States. They're trained to help you choose and enroll in health insurance and to act as your health insurance advocates going forward. Not only are the calls to our service center advisors toll-free, but there are no fees for the advice or services that they offer. VIA Benefits offers all types of individual Medicare plans. That includes Medicare Advantage plans, sometimes known as Medicare Part C, Medicare Supplement insurance policies, also known as Medigap plans, and Part D prescription drug plans. I'll go into further details about each of these plan types in a moment. In order to find insurance coverage that fits your individual needs, it's important to us that you have different plans to choose from. So we work with over 120 national and regional insurance companies. Some of their logos are on the screen now. Whether you recognize the insurance company or not, VIA Benefits is diligent in only allowing plans on our platform that meet high industry standards. In addition to individual Medicare plans, optional dental and vision plans are also available. Medicare insurance coverage begins with a foundation of Medicare Parts A and B, also known as Original Medicare. You must have both Medicare Parts A and B in order to get the additional coverage from individual Medicare medical plans. While Original Medicare covers a lot of things, it doesn't cover everything 100%. There are some gaps in the coverage. Because of these gaps, Medicare allows you to enroll in additional coverage that gives you enhanced medical protection. Your new coverage will be in one of 2 forms, either a Medicare Advantage plan, which typically bundles in prescription drug coverage, or a Medigap plan option, to which you can add a separate Part D prescription drug plan. These individual Medicare plans are not family or group plans. Each individual selects the plan or plans that fit their personal health insurance needs. In addition to these Medicare plans, our benefit advisors will provide information and enrollment support for dental and vision plans. Dental and vision plans are not Medicare plans, and you may enroll into dental and vision plans at any time of the year. Now, let's talk about these 2 main options in more detail, starting with the Medicare Advantage plans. Medicare Advantage plans are offered by private insurance companies who have contracted with Medicare to provide plans that are designed to be as good as or better than Original Medicare. Medicare Advantage plans provide all-in-one plan coverage, which bundle hospital and medical coverage and, most of the time, include prescription drug benefits too. They also can provide other benefits that aren't covered by Original Medicare, like dental, vision, or hearing aid coverage, and even gym memberships. The monthly premiums you pay can be quite low, even $0. But there are out-of-pocket costs, such as co-pays, co-insurance amounts, and possibly deductibles associated with the plan. So the more care that you need, the more you'll pay. Conversely, the less care you need, the less you'll pay. So these plans can save you a lot of money when you're healthy. And Medicare Advantage plans place a lot of emphasis on preventive care. Medicare Advantage plans are network-based plans. This means that they each have a network of doctors and facilities that will accept the plan. The two main types of Medicare Advantage networks are the HMO and PPO types. HMO stands for Health Maintenance Organization. PPO stands for Preferred Provider Organization. An HMO has a narrow network. Your coverage comes from doctors who are in that network. If you need to see a specialist, you probably will need a referral from your primary care physician, and the specialist will also be in the network. PPO plans can have a wider network, and they will allow you to get care from a healthcare provider who is outside of that network. In general, you'll pay a lower cost for coverage if you go to a preferred provider who is in the network than you would if you went to a provider who is outside of the network. Some Medicare Advantage plans offer something known as optional supplemental benefits. These benefits are added to the Medicare Advantage plan, and you can purchase them for an additional cost. Not all plans offer these benefits. We'll talk about details later. Medicare Advantage plans are always guaranteed issue, which means they won't ask about your pre-existing medical conditions, and you cannot be denied coverage if you're over the age of 65. The other option is to enroll in a Medicare Supplement Insurance Policy, or Medigap plan. These Medigap plans work with Original Medicare to fill in the gaps of Original Medicare coverage. Medigap plans don't bundle coverage, so you'll need a separate prescription plan to cover your drugs. While this means that you'll be dealing with two plans and possibly two insurance companies, it also means that you have the freedom to choose separately the medical and drug plans that each fit your personal healthcare needs. Standard Medigap plans have no networks, which means you can't see any doctor or go to any facility in the United States that accepts patients with Original Medicare. There are a few Medigap plans that are labeled Select plans. Select Medigap plans may have a defined network. The premiums for Medigap plans are usually higher than Medicare Advantage plans, but you pay lower out-of-pocket costs, if anything, beyond that monthly premium. If you choose a Medigap plan, you may be asked to pay the first month's premium at the time of enrollment. Medigap plans have simple single-letter names in most states, like Medigap Plan K or Medigap Plan D. There are up to 10 different standardized Medigap plans that offer varying levels of coverage. For example, a Medigap Plan G is considered an exceptionally comprehensive plan. After you pay the monthly premium and the Part B deductible, the Plan G will pay for 100% of the remainder of your Part A and Part B medical costs for the rest of the year. Due to recent Medicare changes, two of the options, Plans C and F, will no longer be offered to those who first became Medicare eligible in the year 2020 or later. Medigap plans will be offered through different insurance companies, but the plan will work the same regardless of which company you select. That is, a Plan L from one insurance company will cover Medicare the same way as a Plan L from another insurance company. The difference in Medigap plans from one insurance company to another is the cost of the premium, as they each set their own premium price for their Medigap plans. So a bargain price does not mean less coverage. Let's take a few moments to discuss Medicare prescription drug plans. All Medicare prescription drug plans, whether they are standalone Part D plans or bundled into Medicare Advantage plans, have the same basic structure, but they can vary widely in which drugs they cover and what they charge for those drugs. That makes choosing a prescription drug plan a very personal choice, because most people take a different set of drugs than someone else. Prescription drug plans start with a formulary. Formulary is the name for the list of drugs that a plan will cover. Each plan can have a different formulary list, and each formulary will divide that list of drugs into separate tiers. The cost that you pay will be determined by the insurance company and the tier level that they've assigned for your prescriptions. We usually see 5 tiers in a plan's prescription drug formulary. Tier 1 drugs will be the less expensive preferred generic drugs. Tier 2 is usually called non-preferred generic. Tier 3 is for preferred brand name drugs. Tier 4 is for non-preferred brand name drugs. The prices usually increase as the tier levels increase. Tier 5 is called specialty drugs, for drugs that are very expensive. Medicare separates prescription drug coverage into 4 coverage levels that you can potentially reach during any given year. First comes the deductible level, which can range anywhere from $0 up to $445. Then comes the second level, which is called the initial coverage level. In this level, you'll pay a set copay depending on the tier level that the medication's been assigned to by the insurance company. This is very similar to most other prescription plans, and 75% of Medicare enrollees will remain in this level of coverage for the remainder of the calendar year. If the full cost of the drugs that you purchase during the year reaches $4,130, then you move to the third level called the coverage gap or the donut hole. This happens to about 1 in 4 of Medicare enrollees. If you reach this level, instead of a tier level copay, you'll pay a percentage of the retail cost of the drugs, 25% for both brand name and generic drugs. Most of those who enter the coverage gap level will remain there for the rest of the year, but your insurance company is required to keep track of one more thing called your true out-of-pocket cost. The true out-of-pocket cost is a combination of what you've spent on your drugs from the first of the year and manufacturer discounts while you were in the coverage gap. If that combined total reaches $6,550, then you'll transition to the fourth level called catastrophic coverage. In this final level, you'll pay a minimum copay of $9.20 for brand name drugs and $3.70 for generics, or 5% of the cost of your prescription, whichever is greater. About 4% of Medicare enrollees will reach this level. This is an annual cycle. Each January, the process begins again at the first level. If all of this leaves you scratching your head, you are not alone. Since most people take a different set of drugs than someone else, your experience with these levels can be quite different from other Medicare enrollees. Fortunately, when you enter your prescription drugs into your personal profile at Via Benefits, our search tools can simplify all of this for you. In fact, I think that the most important thing you need to remember about Medicare drug coverage is this. Our search tools will easily be able to tell you how these coverage levels will apply to you and give you an annual cost estimate for any prescription plan available to you, so you can make a confident and informed decision about your new drug coverage. If you are HRA qualified and hired prior to July 1, 2012, you are eligible for catastrophic prescription drug coverage beginning September 1, 2021. You can be reimbursed for all out-of-pocket prescription drug expenses once the catastrophic level of coverage has been reached for those eligible for an HRA. You must submit proof that the Part D catastrophic level has been reached. You can use the monthly statement from your insurance company. More information about this benefit will be included in your Via Benefits Guide to Reimbursement. Our next topic is the Via Benefits enrollment process. Via Benefits helps you enroll in health insurance through an efficient and proven 3-step process. Your time is valuable, Go online and take these steps in order to maximize your time. The 3 simple steps to enrollment are to prepare. Gather your information, your current doctors, your prescription drugs, and your Medicare card information to create a VIA Benefits account. And if you choose, you can set up a call to speak with one of our benefit advisors. Then review. Use our Shop and Compare and other decision support tools to understand your options based on the specific requirements entered into your VIA Benefits account. And finally, enroll. Enroll online. It's fast, secure, and easy. Prepare to enroll by gathering your information and creating a VIA Benefits account. We ask you to create an account and add your information so our decision support tools can show you plans which meet your specific needs. When you create an account, we'll ask for your personal information. This includes details such as your name, email address, home address, and telephone number. Please note, we never sell or distribute your personal information. If you provide us with an email address, we will send you communications via email, like newsletters and other Medicare-related information. You can easily opt out of those emails as well. We'll ask for your Medicare ID number and the effective dates for Medicare Parts A and B. Entering your prescription drugs into your profile will help our search tool find the prescription drug plans which cover the drugs that you're currently taking. Make sure that you enter the name, dosage, and frequency of the drugs that you currently take. Essential doctors are the ones that you currently see. If you're interested in Medicare Advantage plans which have a network, please enter the names of your essential doctors. We want to ensure that your doctors are in the network. The final preparation is optional. You can schedule an appointment with a benefit advisor during your enrollment period. Once you complete your online profile, you can set up an appointment with a benefit advisor while you're still online. Our benefit advisors are licensed and certified in plans across the United States. An appointment is recommended because your time is valuable, and we want to pair you with someone who's knowledgeable about the plans available in your area. Setting up an appointment allows you time to go through our website and shop for plans, or go to the Help and Support section and learn a little more about Medicare. In any case, we'll have someone available for you on the date and time of your appointment. If you prefer, you can review plans and enroll online. The VIA Benefits Enrollment Guide contains information about Medicare, how it works, an overview of your plan choices, and how to review your plan options and enroll online. You should receive your enrollment guide by mid-June. It will also contain the phone number to call and the web address. That number is 1-833-945-1104. And the website is at my.viabenefits.com/Altria. This guide does not contain detailed plan options and information. You can view that information online by visiting our website at my.viabenefits.com/Altria today. Shop and Compare allows you to view and compare Medicare-related insurance plans available in your area and sort them by price, plan type, insurance company, and other factors. With just a few clicks, you can compare plans side by side and review the details of plans that interest you. If you're looking for Medicare Advantage plans, those plans have networks. If you choose to create an account, you'll be able to enter your preferred doctors in the My Doctors section and your current prescription drugs. This will help select medical plans like Medicare Advantage plans that include your physicians and the Part D prescription drug plans, which include the prescriptions that you take. Earlier, we spoke about optional supplemental benefits, which some Medicare Advantage plans include. If you're shopping for Medicare Advantage plans, the results will clearly display when a plan offers optional supplemental benefits, like dental, vision, and hearing aids. You can click on the link to see more details about the benefits offered. Another tool on the website is the Help Me Choose tool. This tool will ask you questions about your needs and recommends the types of plans that might fit those needs. You can then compare actual plan details on the website. If you entered your physicians in the My Doctors section and the prescription drugs that you're currently taking, you'll be able to see the plans which your doctors accept and the Part D plans which cover your prescription drugs. One of the best things about the website is that it operates 24/7 for your convenience. The address again is my.viabenefits.com/Altria. When you search for plans, if you haven't entered your prescription drugs or your prescriptions have changed, you're able to enter or update the prescriptions in your personal profile, which will then compare the coverage of those drugs between the different plans available to you. Once you've made the decision on which plan or plans you want, choose Add to Cart. Your shopping cart and the plan or plans you selected are displayed. Then select Start Checkout near the bottom of the page. The Steps to Checkout page appears. Enrollment for most plans can be completed online. Each plan indicates whether a call to a benefit advisor is required to complete your application, or if you can complete your enrollment online on your own. During the checkout process, you'll be prompted to schedule an appointment to complete your enrollment if necessary. Follow the steps to checkout and enroll in the plans. 7 to 10 days after your enrollment, you'll receive a mailing from Via Benefits called the Selection Confirmation Letter. This letter will list the plans that you've enrolled in. This letter cannot be used as proof of payment or proof of insurance. You'll receive your insurance cards and the full plan details in separate mailings from the insurance company. When you receive this document, please review it to make sure that you understand the information, and if you have any questions, please give us a call. At Via Benefits, we're here to help you throughout the year, not just during open enrollment. We have a help and support page where you can find the answers to most of your questions, which is always available to you 24/7. If you have additional questions about your plan, you can contact Via Benefits during our business hours. And if you need us next year, we're still here to assist you year-round. When you create an online account, you have the convenience to shop for, compare, and enroll in new plans each year. It's important to keep your profile up to date. For example, if you started taking a new drug, add it to your profile so when open enrollment comes, you can compare plans based on the prescriptions that you currently take. It's time to talk about the Health Reimbursement Account, or HRA. This section applies to those who are eligible to receive post-65 retiree benefits, that is, those who were hired prior to July 1st, 2012. The HRA is a tax-free account established by Altria to reimburse you for eligible healthcare expenses. As part of its IRS definition, you must pay first and then you'll be reimbursed from this fund. Funds will be available starting September 1st, 2021. If eligible, your funding amount was included in the Via Benefits Enrollment Guide. The HRA amounts are based on years of service prior to retirement, the date of retirement, and if you are the retiree or dependent. You may use these funds to reimburse yourself for premiums on your medical, prescription, dental, and vision plans, and for out-of-pocket costs on other eligible expenses. Any unused funds at the end of the year will roll over to the next year. Here's how the reimbursement works in 3 easy steps. Altria will allocate benefit dollars to each eligible retiree's HRA account, and you'll then work through Via Benefits to enroll in your individual coverage. First, you make the premium payment to your insurance company. Second, notification comes to us at Via Benefits that you want to be reimbursed for that payment. That notification can come from you or from the insurance company, depending on which reimbursement option you select. Third, VIA Benefits processes your request and checks to make sure that you have the proper funding amount available in your HRA account and deposits your reimbursement directly into your designated bank account. You can improve, streamline, and automate your reimbursement experience. Signing into your VIA Benefits online account is a secure way to request and manage your reimbursements. From your account, you can set up direct deposit. This is the fastest, safest, and most secure way to receive your funds directly to your bank account. You must sign up for direct deposit to receive reimbursements from your HRA. You can automate your premium reimbursement. You can turn on automatic premium reimbursement from your online account if it's available for your plan. Automatic premium reimbursement enables you to be reimbursed for premium payments without submitting a monthly reimbursement request. VIA Benefits offers this feature for most insurance policies. You can go paperless. Reduce the amount of paper mail you receive from us by registering for electronic statement delivery and notifications online. From this same web address, you can also check your current funding balance and see the status of reimbursement requests and related transactions like electronic deposits. Automating processes and using these steps improves security and increases reimbursement speed. Plan on an additional 10 days if you print and mail or fax a reimbursement request. For your added convenience, there's an app you can download to your smartphone or tablet to manage your reimbursement account. The easy-to-use VIA Benefits mobile app is integrated with the website and intuitively designed so you can manage your HRA quickly. With the mobile app, you can check reimbursement status, check available balance, submit new reimbursement requests, or take a picture and attach documents to your reimbursement requests, all from your smartphone or tablet. The mobile app is available for iOS and Android. Let's drill down into how our automated features work, such as direct deposit and automatic premium reimbursement. Automation is the most secure method to be reimbursed. Automatic premiums reimbursement is convenient. Once you set it up, the reimbursement is automatically returned to you on a monthly basis through direct deposit. This type of reimbursement can be used for premiums on the plans that you enroll in through VIA Benefits. Over 90% of the plans sold through VIA Benefits support this feature. When you choose automatic reimbursement, each time that you pay your premium to the insurance company, they will send VIA Benefits notification of your payment. We will then directly deposit the reimbursement into your designated account. With automatic reimbursement, you do no paperwork at all. To receive your reimbursements, you'll need to set up direct deposit. All you need is to provide your bank information for where you want the reimbursement to be sent and use the online form. It's safe, secure, and easy. You should receive your reimbursement within 30 days or less from the time that you made your payment. Most reimbursements should come around the same time each month. If your plan isn't available for automatic premium reimbursement, you can submit for your premium to be a recurring reimbursement, meaning you will be reimbursed for the same amount every month. If you can be reimbursed for out-of-pocket costs, this is the same process. The only difference is that you submit for out-of-pocket expenses as you incur them. Those are not available for automation. Again, be sure to set up direct deposit. All necessary instructions on how to use your HRA will be provided in your reimbursement packet, which should arrive around the same time that your new coverage takes effect. This is a very important fact about your HRA. In order to continue to receive funds in your HRA, you need to enroll in a medical and/or drug plan through VIA Benefits before your enrollment period ends on August 31st, 2021, to have access to your HRA. And you must remain enrolled in a medical and/or drug plan through VIA Benefits each year to continue to have access to your HRA fund. VIA Benefits offers additional healthcare benefits. VIA Benefits offers other non-Medicare benefits available in your area. Options could include accident insurance, life insurance, hearing aid plans, senior critical illness insurance, and hospital indemnity insurance. Ask your benefit advisor if you're interested in any of these additional benefits. We're just about finished. I just need to call attention to a couple of important items. The next step for you to take is to prepare. Gather your information and create a VIA Benefits online account. Add details such as your current prescription drugs and doctors so our decision support tools can show you the options which meet your specific needs. Remember, when you create an account, we'll ask for your personal information. This includes details such as your name, email address, home address, and telephone number. Again, we never sell or distribute your personal information. If you provide us with an email address, we will send you communications via email, like newsletters and other Medicare-related information. You can easily opt out of those emails as well. Entering your prescription drugs into your profile will help our search tool find the prescription drug plans which cover the drugs that you're currently taking. We'll ask for your Medicare ID number and the effective dates for Medicare Parts A and B. Essential doctors are the ones that you currently see. If you're interested in Medicare Advantage plans, which have a network, we want to ensure that those doctors are in the network. After you create your VIA Benefits account, if you choose to do so, please set an appointment with a benefit advisor during open enrollment to discuss your plan options and answer any questions that you may have. Once you create your online account and enroll in a plan, you'll be able to manage your HRA from that same account. From your account, you can set up direct deposit and automatic premium reimbursement. In conclusion, I'd like to thank you for taking the time to view this presentation. I went over a lot of material, and you likely have many questions. If so, please feel free to call us at 1-833-945-1104. Monday through Friday, from 8 o'clock in the morning until 9 o'clock in the evening Eastern Time. Or visit the website at my.viabenefits.com/Altria. We look forward to working with you soon. On behalf of Altria and VIA Benefits, thanks again for watching and have a great day.